Salam and hello everyone, welcome back to the channel. My name is Khadija and I hope that you are all doing well. So for today's video I am going to talk about Serrapeptase. Shout out to Rosalind from Cherish Your Rose who asked me this question based off of actually one of my older videos on the DIM supplement. So here we're going to talk about Serrapeptase supplement, and before we jump in I do want to say that I use this biotechnology reports by Jadhav et al. It's a pretty succinct article that talks about the history and some of the medical information of why Serrapeptase was initially used in preclinical and clinical studies. So I will leave a link for this source below, but if you have the time, check it out, read it. It's been used by multiple health sources online, but it's a really good succinct article, and it wasn't published that long ago, 2020, which is really good in terms of seeing up-to-date research and what's new or happening with this particular over-the-counter agent. So in this video I'm going to talk about Serrapeptase, also known as serralicin or serratiopeptidase. I'm going to give a quick scientific breakdown. I want to talk about some of the benefits and how to take the agent. I do want to give you some warnings and precautions as well as some side effect information, and I'm going to talk about how this particular agent might be used for the benefit of women's wellness and health. Serrapeptase is an enzyme with essential therapeutic applications that helps normal bodily functions. It helps with digestion, metabolism, immune function, reproduction, as well as respiration. It helps break down protein into amino acids, and it is isolated from the intestine of a silkworm. And this is a little image here of the silkworm. If you are so bold enough that you want to see a real life image, then I will leave a link as well in the description for you to check that out. Serrapeptase is usually dosed between 10 milligrams and 60 milligrams in the studies that have been published. It is an enteric-coated capsule, so that means it just has a delayed disintegration time release so that it doesn't hit your stomach acid and completely is disintegrated, so it doesn't work. So that's why it's enterically coated. It has a protective layer so that the product can move into your system and work a little bit better. And it's actually recommended that you talk to a healthcare provider to get a prescription for Serrapeptase, even though it's available over the counter. And the reason is your healthcare provider will better be able to assess what you're going through and to give you an appropriate starting dose, whether it's going to be the 10 milligrams or the 60 milligrams or more than that. And it's important because they're going to be looking at what you're currently experiencing in terms of dis-ease or illness and how to appropriately manage that particular state that you're in. So let's talk about some benefits. Both preclinical, the lab, and clinical with humans have shown promise. It's shown to be anti-inflammatory, so inflammatory disorders such as arthritis, sinusitis, bronchitis. It was first used for anti-inflammatory effects in Japan in 1957, so there have been some known benefits to Serrapeptase. And I'm cutting in here to also mention that silkworm has traditionally been used as a diabetic treatment in such nations as China, Korea, Japan, and several studies have recently proven that silkworm has a blood glucose lowering impact. So that information I will also link for you in the description below. Serrapeptase has also been shown to be highly effective against bacterial biofilms, which are multicellular structures of dense and highly hydrated communities of microorganisms, which can be very hard to treat. And also, they lead to persistent infections. So that's why when you're dealing with something that's very resistant to current antibiotics or current treatment guidelines, it's going outside of the treatment regimens for whatever reason. Sometimes it does happen. Sometimes providers do recommend trying something different. Serrapeptidase is also known to dissolve plaque buildup, dissolve blood clots, atherosclerotic plaques by breaking down fibrin and other damaged tissue. It is also known to be an analgesic, and as I mentioned before, it also treats. Now, there's a caveat. There are first-line agents and other agents with a better known profile for treating inflammation, bacterial infections, respiratory infections. So serrapeptase is not going to be the first line. It's not going to be recommended first line, but it might be recommended if some other things do not work for a particular patient, or if you're talking to a more naturopathic leaning provider. Now let me talk about some warnings and precautions. When you're considering taking serrapeptase or any over-the-counter agent or any herbal remedy, it's important to know your current regimen and what you're taking. So for example, with serrapeptase, you do not want to take this medication with other blood thinners because this medication thins blood. So we're talking about concomitant therapy, warfarin, heparin, apixaban, aspirin, just to name a few. You want to be really careful that you're not causing a synergistic effect of thinning out your blood, which could lead to a bleed. Now, if you're pregnant or breastfeeding, or you think you might be pregnant and you want to continue breastfeeding, again, serrapeptase should not be taken. And then there are also some reports, but limited, of skin reactions, muscle and joint pain, cough, poor appetite, nausea, and stomach pain. Now, when we talk about side effects, even though I just mentioned that there have been some reports of skin reactions and things of that nature, the studies have shown that there are limited or no side effects. And there are several studies that have been using serrapeptase, not primary research controlled trial, which is the gold standard for, I should say double-blinded, randomized, placebo-controlled trial are the standard of research and the gold standard of research trials, and we don't have that right now with serrapeptase. But even though I mentioned that, I just want to continue to say that with side effects, even though they have been shown in some studies that have no or little side effects, this doesn't mean that you are in the clear just to take it. Remember the warnings and precautions that I just mentioned in the previous slide. Understanding your current medication protocol is really important. Have a qualified healthcare provider review your current medication list if you are on other medications or if you are experiencing some type of health situation, so that they can properly assess whether serrapeptase is going to be an all-right alternative for you to try. Food intake is also important, which I will probably get into that in a future video. And then again, more research is needed to confirm the efficacy and long-term safety of serrapeptase. Now, for the use in women, use of serrapeptase for treating fibroids, primarily because that was the question I was asked, is mixed. Some women find benefit, some women do not find benefit from taking serrapeptase. And unfortunately, when I was doing my research, I could not find enough qualified, or I should say I could not find enough quality driven data to confirm, even if by percentage or by region, that women have been known to take serrapeptase for treating fibroids. Although the cause of fibroids is unknown, hormones can stimulate their growth. Fibroids are estrogen and progesterone sensitive, so they often shrink after menopause when ovarian production of hormones diminishes. Now, for many of you watching, you are not in the menopause stage. You are in the perimenopause or premenopause stage, and you're experiencing fibroids, so you are looking for relief. I hear you, I understand that, and that's why I am going to actually dive into that in more nuance in my next video. I want you to get a better understanding of fibroids and how they are currently treated according to current medical guidelines. And I also want to talk about if there is any room for natural therapy. So this is non-pharmacological therapy, non-pharma therapy, or surgery. So we want to push away from that. We're not push away from that, but we want to talk about some alternatives, because I know that some of you do not want to take medication and you do not want to go under the knife. You do not want to have surgery. And I am going to be using a lot of literature in preparing this information, including information from the Menopause Society, because they do talk a lot about abnormal uterine bleeding for women who are in their late 30s, early 40s, because you see a lot of fluctuations in hormones. So you also also see a lot of fluctuations with the expansion and the growth of fibroids and then the shrinking of fibroids. Fibroids can be impacted by a lot of things: hormone imbalances, food intake, prior medical treatment or medications that you're currently taking. There are a host of factors that make treating fibroids more nuanced, more detailed. So that's something I want to get into a little bit more detail in the next video. But as far as serrapeptase is concerned, some have found benefit, some have not found benefit. As I mentioned before, unfortunately, literature and data are very limited on the use of fibroids, on the use of serrapeptase for fibroids. And that's why I want to get into more of the agents that are commonly known and used to treat fibroids. I hope, Rosalind, and any women watching, that this information has been beneficial for you. I know it is not very helpful in terms of using it for fibroids, and that's why I want to dive deeper into how to approach treating fibroids from a holistic and from a medical perspective. So I do thank you for watching, and if you have any questions, please leave them in the comment below. I don't mind doing the research. I enjoy doing the research, and don't forget to subscribe. And I thank you for watching, and I shall see you in the next video. Take care. Bye.